Well, it's a great day here on Welcome to Our Community as I get a chance to have a chat with Dr. Bonzo Reddick, who is the Health Director for the Georgia Department of Public Health, the Coastal Health District. Thank you so much for being here.
Thank you so much for having me.
Well, I really want to talk to you, of course, during this hurricane season because even though you all have had this hurricane registry around for years, many times our most vulnerable residents who need it know nothing about it. So please explain what it is and how they can get registered.
That's correct. So we actually have two hurricane registries, although we usually refer to them collectively as just the hurricane registry. We have one for people with medical needs and also one for people with functional needs. So functional needs are, for example, people that might be a wheelchair user that has trouble walking or ambulating, and if they have difficulty evacuating during a hurricane, don't have anybody that can get them to safety, we have a registry for them that can actually keep track of them, help get them to a shelter if there's a need to evacuate, and also get them back home safely. Medical needs are for people that have medical problems like dialysis or they use oxygen. In other words, they have services that require electricity. So if there's a storm, electricity power goes out, they will not be able to have their life-saving medical interventions, oxygen, CPAP, or whatever it might be. So we have registries for both of them available, and a lot of people don't know about it.
So how do people go about getting their family members registered for this?
A couple ways to do it. You can go to our website, coastalhealthdistrict.org, and we have an entire section about the hurricane registry that'll pop up. But also, they can just call their local health department. And I always remind people that it's not just Chatham County. I know you have listeners around surrounding counties, but we're all 8 districts, all 8 counties along the coast. So that's Effingham, Bryan, Liberty as well. You can just call your local health department as well, and they will tell you and help you get on the registry.
Now, I know that we're into hurricane season. Is there still time for people to get registered?
Absolutely. So we actually have the registry open up until 72 hours before a hurricane strikes. We do have to close it eventually because we have to know how many people we have, be prepared, and also start getting them to safety. So we do have time to do it right now, but no time like the present, right? So right now is the best time to do it. And we always tell people, don't worry if you're not sure if you're eligible. If you say, I think I might be eligible, or I think my mom or grandma might be a good candidate, just err on the side of calling. We won't get upset with you if you're not eligible. So we'll tell people, just call and see.
That is true. You know, we don't hear a lot about COVID anymore, but we do know that it is still there and people are still getting sick. Can you remind people about the dangers of COVID-19 and what they should be doing right now?
Yeah, so COVID-19 is still with us, and it's a interesting thing because there's sort of good news, bad news. The good news is that COVID levels right now are the lowest they've been since the pandemic started. So people hear that and say, oh, I don't have to worry about it anymore. But unfortunately, COVID still kills people. Even though the rates are low, it still kills people. Flu is the same way, right? Flu comes down every year, and it kills tens of thousands of people every year. And so you still have to take it seriously for things like flu and also for COVID as well. And so that's things like the same thing we preached throughout the pandemic, right? Is if you're eligible and your physician recommends it, getting your COVID vaccine. If you are sick, stay home. You know, if you absolutely have to go in public when you're sick, wearing a mask. Those things we did, and they actually allowed us to get to the point where we are right now with COVID. So we don't want to go backwards.
That is true. And also, we're in the middle of the summer, school's still out, but we also, as families, we have to start thinking about those kids, getting them ready for the new school year. What should families know about immunizations and how they can go about getting those things straight for their kids?
Similar to the hurricane registry, no time like the present. Go ahead and do it right now. Our nurses at the health departments are great, and so if you come in last minute, they will work with you, but please try not to come in last minute. Now is the perfect time to do it. I actually just got a notification from our school nurses. We do a kind of back to school orientation every year, so we were just getting that scheduled. And there's a great reminder to go ahead and call your health department. They can look at the registry of vaccines and see what shots you might need and help you get plugged in. And I'm sorry.
Go on.
And we also, the other thing that gets people by surprise is the EED. And you parents know what that is. It's the ears, eyes, and dental. So for your first time coming into school, you have to have an eyes, ears, and dental evaluation as well. And we do those at the health department.
So all that in one place makes it very easy for our families.
Yes, it does. And we even have an EED, or actually 2 EED days here in Chatham County where you can come to the health department and we just line people up and do hundreds of EED evaluations in a row. Dr. Smith, our great dentist, and our nursing team, they do that as a service for the community.
Anything else people should know about the health department? I think sometimes people only think about you all when they're sick, but there are things that you all are offering all the time that are really beneficial for us having a good life.
Perfect. So the big thing I try to point out is this, you know, the cliche is an ounce of prevention is worth a pound of cure. So we do a lot of things to try to prevent problems. So even like the hurricane registry we mentioned, don't wait until a hurricane comes to respond. And likewise, when we think about emergency preparedness in general, we work with a lot of great partners in our community who actually help us teach those things. So like the Savannah Youth City Incorporated group is actually helping us do emergency preparedness trainings. They actually have it all set up. and we've been helping to co-teach some of their sessions. So they do great community trainings that are offered to the public, have dozens of people coming out learning how to prevent these problems. Or if you're stuck in an emergency or disaster, God forbid, something like we had it last week here in Savannah, you know how to help people stop bleeding if an emergency comes. If you're in a hurricane and power goes out, you know how to respond. So we just tell people, take advantage of these community offerings that are out there, that the health department, some of our different partners that are offering, and prevent these problems before they come.
Sounds like good advice right there. Thank you so much for being here.
Thank you.
And we certainly appreciate all the good work you all are doing throughout our community.
Thank you so much.